Welcome to the Healthcare Leadership and Innovation Podcast, where we explore the evolving landscape of healthcare leadership, innovation, and the capabilities needed to lead organizations through transformation. I'm Christoph Winkler, Director of the Hynes Institute for Entrepreneurship and Innovation at Iona University.
And I'm Kavita Dhanwada. I'm the Dean of the New York Presbyterian Iona School of Nursing and Health Sciences. And we are very excited to launch this podcast series as part of Iona's broader healthcare leadership and innovation initiative. At Iona, our MS in Healthcare Leadership and Innovation program was designed to prepare professionals to lead healthcare transformation by combining healthcare expertise with innovation, technology, leadership, as well as cross-cultural, cross-sector collaboration. The healthcare industry is changing rapidly, and organizations increasingly need leaders who can navigate complexity, redesign systems, and drive meaningful innovation.
This podcast is designed to bring together healthcare leaders to discuss the future of the industry, leadership lessons from real-world experience, and the skills needed for the next generation of healthcare leadership. Today, we're honored to welcome our first guest, Tom Halloran.
Before we start our podcast, I would like to share Tom's bio. So Tom is an Iona alum, class of 1987. He is a results-oriented executive with nearly 20 years of C-suite experience, including 6 years as CEO of Fidelis Care New York, a subsidiary of Centene Corporation, a Fortune 25 company, and his professional career has been grounded in his background as a CPA and complemented by 15 years of turnaround experience as an Anderson partner and founding managing director at Halloran Consulting Group. As CEO, Tom guided Fidelis through a rapidly evolving healthcare landscape, including the challenges of the COVID-19 pandemic. Over his 6-year tenure, the plan grew to serve 2.4 million members, strengthened relationships with regulators, and advanced quality initiatives in support of its mission. As CFO at Fidelis, Tom led the financial aspects of a 2-year sale process and advised the board of directors, which culminated in a multi-billion-dollar transaction with Centene in 2018. Now, Tom has recently retired from Fidelis, and he looks forward to sharing his leadership experiences across the healthcare industry to enhance customer experience through innovation, to advance growth and quality.
Tom, welcome, and thank you for joining us for this inaugural episode.
Christoph, Kavita, thank you. Thank you for the warm introduction. I appreciate the opportunity to partnership with you.
Okay, thank you. Tom, you know, we had just heard your bio, and kind of when you look at your career trajectory and all the way to kind of where you are in your career in terms of your leadership role, what are any kind of pivotal turning points along the way?
I had the opportunity a couple of years ago to speak at Iona's mentoring program, and one of the key themes that I try to leave the group with was that careers are not linear. It's more like a game of chutes and ladders. There's ups and downs, there's twists and turns. And as I reflect on my career growth, I mean, it started here at Iona. First in my family to graduate college. Very fortunate that I had parents willing to sacrifice and support me. Great deal of value on education. I was very lucky then to get a role with Arthur Andersen coming out of school. And I found myself as an auditor. Did that for about 4 years before I found myself bored. And while I was trying to figure out what to do, you know, the great thing about an organization like Andersen, who valued people, who valued the investment in development and training, as well as strive to on excellence as well as collaboration. Hey, let's take this resource and redeploy them. So I had an opportunity to move into Andersen's restructuring group after 4 years. Did that for about 10 years. Found a lot of hot spots around the country. I was in Elkhart, Indiana, Thomaston, Georgia, Biddeford, Maine. Spent a lot of time on the road doing manufacturing. Had some success, which contributed to making partner. I made partner 10 days before 9/11. 6 months later, I'm looking for a job. I'm looking for a job because the firm imploded, and I was one of 25,000 employees that was looking for a job as a result of the Enron scandal. And I was fortunate to find an opportunity with Huron Consulting Group. So I joined Huron Consulting Group, and I had a little bit of an aha moment to say, okay, manufacturing is moving offshore, so maybe I need to move into an industry that's not going away. So I made a decision that I'm going to stay in restructuring, but I'm going to spend more time in healthcare. And so I had the opportunity to be involved in a number of healthcare restructurings, again, around the country, DC, Phoenix, even in New York City. Then came to another crossroads. 20 years into a career and saying, I have 3 little kids at home, spending a lot of time on the road. I love what I was doing, but I also was realizing sometimes the best consultants were the ones that had C-level experience. So I said, let me go off and do that. And so I found a role as CFO at Fidelis. Fidelis is a Medicaid managed care plan here in New York. When I joined it had 350,000 lives. As Kavita indicated in my intro, we grew to 2.4 million. So I took the role, and my plan was I'm going to do this for 3 years, and then go back to consulting. Well, I stayed 18. And I stayed 18 because the organization was growing. I was growing professionally. I was relevant. I was being asked to provide insights. I would never have thought about it when I left Iona in 1987 that I would have had the opportunity to lead the organization as I did for 6 years. So again, there's always twists and turns, and with those twists and turns, take the road where it goes. And the other big thing I would say is look at who's on the journey with you, because that's really important, and that will probably drive success as much as anything you're going to do.
Excellent.
Right. No, absolutely. I mean, definitely chutes and ladders. That's
Yes.
really interesting. So can you speak a little bit about how your leadership development, you know, kind of flowed as well?
I like to say it's ongoing. It's a work in progress. When you're in professional services, you find yourself supervising people pretty early on in your career. I was 3-4 years in a career, and I was supervising people, and it's hard. It's difficult, and particularly when they're not doing it the way you did it. And then there's a realization that you don't have a patent on the only right way. And so what I'd say is, as I reflect on my leadership development, which is ongoing, I've gone from taskmaster to a supporter to a partner to a coach, now an advisor. And as I've gone on that journey, what I've realized it's pretty important is, A, set the expectations. Set the expectations, have it clear in terms of what deliverable looks like. Get aligned with success. Get out of the business of telling people how to do it, and then supporting them in terms of finding it. And it's also important to have the diversity of ideas at table, you know, whether it's ethnic, functional. One of the great things about Fidelis is we always had different people at the table, you know, whether it was clinical, whether it was operational, whether it was technology, whether it was financial, and collectively we got to the right answer. And that's probably the thing that I would say is it's an ongoing journey. And as I grew as a leader, I became more confident in accepting constructive feedback, right? And to the point where I would seek it out. And there was moments, particularly people that are junior to you, offering constructive criticism, and I think, okay, that took a lot of courage for them to stop. It's important for me not to be defensive, and me to step back, reflect, and more often than not realize that subconsciously, consciously, there are behaviors that need to be adapted and addressed as part of the ongoing growth as a leader.
Excellent. Well, thanks for sharing those insights in terms of you know, kind of leadership and how it applies in terms of your journey. I mean, healthcare organizations today are really navigating a lot of, you know, changes, and particularly technology is driving a lot of that. But also workforce challenges. I think also different expectations by patients, but also operations themselves, consolidations and others kind of create even more and more complexity here. So my question to you is kind of like, what do you see kind of the biggest gaps between kind of what leaders are doing and what they're kind of getting in that kind of conversation and in order to really advance those organizations?
Yeah, I mean, it's hard right now. There's a lot of pressure economically, regulatory change, political uncertainty, let alone the introduction of AI and what that means in terms of, and many people are doing the best they can, and they're going from day to day, and it's hard to kind of have the ability to step back. And some of the challenges, I would say, are one, getting stuck in your own silo, as opposed to being in a position where you're looking at things more holistically, looking at it from the customer experience. You know, recently we had a situation at Fidelis where we were looking to improve our quality scores, and we said, let's do an end-to-end as to how many touch points we have with our member in order to improve quality, make sure they're getting the appropriate screenings, testing, and the like. And we realized we had 43 outreaches. So it wasn't a lack of outreach, it was a lack of coordination in terms of looking at it from the member experience, because the member was saying enough already. So I think, you know, having that holistic view is one thing versus, you know, falling track of being siloed. AI, technology, it's not a silver bullet.
Yeah.
And I think sometimes people make the mistake in business of, if I buy this, bolt it onto what I already have, it's magically going to be better. When in reality, it's really, really important to understand your processes and your people. And many times we would sit at the table and say, it's about people, process, technology. And it's the balancing of the three, making sure that we understand the operational processes, figure out how technology can enhance it, and then leverage the people first to train, but B, to be part of a continuous feedback loop so that, you know, the processes and the technology are working hand in hand to actually accomplish whatever the end goal is. The other thing that we run into as leaders, sometimes it's easier to just punt. You know, I got a lot going on, I'm back to back, I can't really focus on making that call, or I don't want to make the call today. And what contributes to that is, well, you know, you got regulatory challenges, you might have a rigid procurement process, you might have financial pressures. But interestingly enough, I'm seeing and feeling, particularly over the last year, more of a drive to technology adoption. And last night I had dinner with a couple of founders of an AI technology company, and they are sharing with me that a lot of their cold calling would go unanswered 6-12 months ago. They're now seeing more response. It's almost like the founder CEO said to me last night, it's almost feeling like corporations have said people now realize they need to be coming up with efficiencies, and to the extent you can do it with AI, let's do it. So it's mindset, but at the end of the day, it's having that holistic view and realizing technology is a part of it in working with your people and your processes.
Excellent. Thanks for those insights.
Yep.
So as healthcare organizations actually think about developing their future leaders, education, in my opinion as a team, continues, I think, to play an important role. So when you're hiring or developing new leaders, what do you look for in that graduate degree that signals to you, you know, their abilities or to kind of to succeed?
It's almost, even before you get to abilities, is their commitment. So the fact that they're committing to a graduate program says that there's indication they're curious, indication that there's a level of stamina, because most people are doing it in conjunction with full-time roles. It also says to me the ability to manage time, because I'm looking at this individual as a professional, but they're a student. They're probably got personal titles, whether it's as a spouse, a child, mother or father. And so when I'm looking at it is, you know, somebody that's committed to investing in their own career. And if you have that kind of commitment as a leader, it's like, oh, okay, it's more than half the battle, because now I have somebody that's interested in getting better, has the appropriate curiosity, and is looking to make things better.
So one of the goals of our program at the Healthcare Leadership and Innovation MS is really to prepare the leaders to bridge kind of healthcare operations, innovation, technology, and systems transformation. I know this seems like a big, tall order, but we really try to be careful about putting together curriculum within that program that stands out. That's also uniquely different from an MBA program. So from your perspective, kind of what stands out here in terms of the curriculum?
Yeah, I mean, there's a number of things. I mean, the first thing that I think about is you get into a program like this, it's broadening your strategic thinking, your high-level thinking. Most of us are really good in our functional area, and we're subject matter experts, and you build the confidence. A program like this takes you out of your comfort zone because you are bringing your functional expertise to the table, but you're now being matched up with others and understanding that for the customer experience, the patient experience, it's about having that holistic view. So part of that is the diversification of ideas and experiences that come to the table is what I think about. It's building relationships. It's building relationships because, the more you're in situations that are not part of your day-to-day structure, the more you put yourself in a position where you're building on potential ideas in multiple aspects of your life. And then one of the things that candidly we struggle with as leaders, we want to be right. And a program like this says right is not a point as much as it's a direction. And it's very critical as a leader is not to be analysis paralysis and be in a position where you're making the decision with imperfect data. And that's one of the things I loved about restructuring, because you went with 80%. And with 80%, you went and you knew you were course correcting down the road. And I think a program like this helps you deal with the ambiguity that goes into a lot of the decision making. So it's that broad base, dealing with people that have a diversification of experience and addressing the ambiguity and the uncertainty and having the confidence to make a call.
Yes.
So now that you're transitioning away from executive leadership and have probably had some time to reflect on your career, what does a healthcare leader or the healthcare leader of 2030 or beyond look like to you? And how do people start becoming that leader today?
Yes, so the first thing I would say, reflecting on my career, is shared experiences matter. People are watching you. I've had a number of conversations in the last 6 months with people that were in rooms that I was in, and I didn't even realize they were in the room. I forgot the meeting or the discussion. So it's really, really important to understand that, yes, we're very conscious of the importance of the relationship with our supervisor, but realize that everyone in that room is watching you. And they're watching how you act, how you behave, and particularly in those difficult situations. And so I've had some of that reflection. I mentioned to you I was on the phone on the way up here this morning, and a couple of those calls with people that work with me, and one has asked for me to be a reference, somebody that hasn't worked with me for 10 years. And as I reflected on with this individual, it's like, okay, what are you looking to do? Who are you looking to work with? And what I would say is the key aspects of a leader is, having that fortitude. And one individual was talking about, hey, I'm in a position where I'm making tough calls. Do the right thing. Do the right thing in the long term. So that'd be the first thing. So that's why like an Iona program is critical, where it comes back to people, empathy, as opposed to that cold-hearted business decision that may be
mission-driven. We're
mission-driven.
Yes.
And having led a mission-driven organization and been part of one for almost 2 decades, that is absolutely critical. The other thing I would say is the curiosity, continuous learning, And learning can come from anyone and anywhere. And the openness to engage in new ideas, new technologies. One of the things I'm finding is I'm a beginner at a number of things right now, and it's uncomfortable. But if I'm willing to lean in, I'm going to be better tomorrow than I was yesterday. So I think the biggest things I would say is having that value system, focused on mission, focused on people, and openness to new ideas, new people, and then, candidly, self-care. Self-care. I will say that
That's hard, right?
it is. Well, it's incredibly difficult, and you think when you're in roles you're taking care of yourself.
Right.
I'm going to the gym. I'm I'm eating right. Da 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 da. The reality is I've had a little bit of time to reflect. To your point, I wasn't eating as well as I could have. I wasn't as active as I should have been, and even some of the personal relationships. So self-care becomes important, and the reality is no one day is going to define you. It becomes a series, and so it's important as a leader because people are watching you. As the leader, they're watching you, and they may be the only time in a year that they see you. So it's going to be really critical that you project that energy, that positivity, that openness to learn, and that willingness to work with them, partner them. To the point earlier about my leadership development,
Right.
it went more to a partnership thing to say, okay, we're in it together.
Right.
Yeah, thanks, Tom, for also highlighting the importance of self-care. I think, it often says it's lonely on the top, right? We're at the top. But as you also noted, it's important to surround yourself with people that you can also draw energy from as you also lead people and engage them in important conversations, to engage in the partnership. So really appreciate you reinforcing this, because I think that's also central to a lot of the work. And I think the mission that we have here at Iona, where the community is really the power, the community is the strength. And I think you cannot change large systems by yourself.
Absolutely.
It needs to start with a collaborative effort and really truly understand it. So with that, I want to thank you for joining us today, but also thank you for joining us as one of our executives in residence for this particular program, for sharing your experiences and leadership lessons, but also perspectives about healthcare now, but more importantly, the future of healthcare, which we are trying to really be part of, and particularly through our work here at Iona, but also how we empower our students to become part of that change.
Absolutely. I think your last answer about what is the leader of the future, I think that really reinforces our conversation here today about what healthcare leadership is. It is about kind of thinking about it differently, innovation, adaptability, strategic thinking, as you said, as well as the ability to lead organizations through a continuous transformation. So I think that your answer was very, complete in that sense. As I said, I think the mission is really central. Iona's mission is really central to our newly launched MS in Healthcare Leadership and Innovation program. And we are really very excited to kick off our first cohort this upcoming fall. So I'm very excited about that. So.
Yes, so I also want to thank, obviously, our listeners or people who are watching us for joining us today for this inaugural episode. There will be more, and I believe Tom is also coming back, maybe also switching tables to facilitate some of the conversations with additional healthcare leaders. So really excited about this, so thanks everybody for tuning in.
Yes, thank you again for listening, and we'll see you next time, and Tom will be in this chair. Probably.
Sounds good. Thank you. And I appreciate the opportunity to be part of the program because, as I said, learning is two ways. So thank you.
Excellent. Thank you so much. And see you next time.
Sounds good.